Lim. I'm a board-certified dermatologist practicing here in the province of San Fernando City, La Union. And this is my video about CO2 laser treatments. What should you watch out for? What are the complications? What are the contraindications? And what my tips are for you. So I recently got the CO2 laser. It's a Fractional CO2 laser. It's available here in my clinic in Skinmatters here in San Fernando La Union, and I would like to share to not only my patients but to my YouTube followers what they should watch out for before they have a CO2 laser procedure done and what the possible complications are. So number one is you should understand that CO2 laser is a resurfacing laser. So it is a device designed for ablative skin resurfacing. So it's a deep laser resurfacing, and that the clinical results may vary depending on the different skin type. So patient with a darker skin tone will have a different reaction from a patient with a lighter skin tone. And then you should also understand that there is a possibility of short-term effects such as reddening, blistering, scabbing, temporary bruising, and discoloration of the skin. So right after the procedure, you'll notice your skin is red. Sometimes if the CO2 laser is done deeper, there could be some blisters. And then again, if for example you have like some seborrheic keratosis, some or bigger lesions removed, then there could be some scabbing that can occur. And other times there could be some temporary bruising if for example there's like a double pass on a certain area and or your skin is just sensitive, then you could have a little bruise on certain portions of your face. And other times there's discoloration or hyperpigmentation. Okay, so these are some of the things that you will notice right after and even later on after you have the procedure done. So next is you should also understand there is a possibility of other short-term effects such as number one, post-procedure burning. Number two, sensation of pain. Number three, swelling of the treatment area. And the next one is a visible dot pattern on the skin. So and sometimes also, oftentimes actually, there is a sensitive word such as social downtime of around 3 to 7 days. So what is this burning sensation? So during the procedure, because the laser is hot, so parang medyo mainit yung pakiramdam on your skin. But it is variable. Some patients, they feel it really, it's very hot. Others, they don't feel it. Also, one of the variable thing is that how long is the anesthesia applied on your face and stayed there. So of course kapag mabilis lang, sometimes mas mararamdaman mo. Other times if it's within the period that's indicated for the anesthesia, topical anesthesia to be applied, medyo mas tolerable yung procedure. Next is swelling of the treatment area. So medyo swollen or maga yung face mo right after the procedure. It's red, medyo swollen, and it's hot. And then right after, when the laser beam is applied on your face, you will see a visible dot pattern or a grid on your face. So parang siya maliliit na dots that you will see on your face. For the other settings, like for the one for the mole, for the seb curve, for the warts, it's just for the area that's being removed, dun siya magkakaroon ng mark. And then of course it will scab right after. Next is a social or a downtime for around 3 to 7 days. Because syempre your face is red, swollen, ganyan, there's like a grid or marks. So syempre when you go out, of course it's noticeable. So there's like a downtime of around 3 to 7 days, depending of course on your healing. Because some patients, they heal faster, other patients, they heal a little slower than others. So it varies. Next is you should understand that there are rare side effects. So merong mga hindi madalas na makikita ng mga side effects sa ganitong procedure. Number one is scarring. Number two is a permanent discoloration can occur. So, for example, you have a CO2 laser, sometimes mangingitim yan, and then it can be a discoloration that can last longer than other patients wherein the discoloration or the hyperpigmentation sandali lang. So, you should be wary and aware of this possibility. However, these effects have been should be explained to you by your provider. If your provider is a PDS board certified dermatologist who's been trained, they can be able to explain it to you and handle the complications or the long-term side effects of this procedure. Okay, so you should also understand that your history of, for example, poor wound healing. For example, you have diabetes or you have history of poor wound healing, should also tell your provider that these things about yourself also. And then Next is, if you have like fever, blisters, or like herpes simplex or an infection, you should tell your doctor, dermatologist, or your provider because they can give you an antiviral to prevent it from occurring right after. And then next is, okay, the clinical results may vary depending on the individual factors, including medical history, the amount of sun damage or textural problems, and skin type, patient compliance with pre- and post-treatment instructions, and individual response to treatments. For example, you have the procedure done. You don't have the same results with the next patient because syempre, some patients, mas diligent sila mag-apply ng mga medications, iba yung lifestyle nila, iba yung sun exposure nila. So, the results will vary. So, you really can say na, oh, yung kaibigan ko, doktora, ang bilis, ang ganda na ng skin niya, bakit yung sa akin ganito pa rin? Because of course, you have a different set of history, your medical history is different, the medications you're taking are different, your lifestyle, your sun exposure, all different. So, their wound healing will be very different from yours. So, yun. Next is, okay, you should also understand that the treatment of fractional CO2 laser may involve a series of treatments. So, hindi lang siya one session. So, I do get a lot of patients who want just, ay doktora, isang session lang yung kaya ko. So, I tell them and explain that with one session, you will see some improvement. But of course, we want is yung marked improvement wherein, for example, your acne scars is the reason why you want to have the laser procedure done. You need at least a series of treatments to at least have really good results with this procedure. So, dapat malinaw yun. And then, okay, so next is that you should also understand that with this procedure, it is not an exact science. So, there are no guarantees in regard to the treatment results. And you should also be aware that this condition, for example, you want to do it for your acne scars, it is a cosmetic concern eh. Okay, di ba? And that it is your decision to proceed to have this done. So, hindi mo pwedeng masisi your doctor, dermatologist, if right after the procedure, there's not that much improvement, like for example 100% improvement with the laser treatment for your acne scars, because for me personally, I not only do the laser treatments, we do like chemical peels, we give medications, I prescribe medications. There are a lot of things that you can do for the acne scar and procedures, not just the laser treatment, because you do get a lot of patients, they think na with just one procedure gaganda na lahat eh, and the best results are done with a multiple approach to the problem, and you should just have a consultation with your PDS dermatologist so they can explain it to you so that all your questions masasagot. And then lastly, of course, what are the things na contraindicated? So bawal ito sa buntis. So you can take it if you're you can have the procedure done if you're pregnant. Okay? And then if you're currently taking isotretinoin, which is a medication for acne, it's contraindicated as well. You should at least stop taking isotretinoins. For example, you want to have the procedure done and you're taking isotretinoin. For example, it's January. You can have it done by June or July after 6 months of isotretinoin para maganda yung results. Next is, you also can't have it done if you have a pacemaker or an internal defibrillator. And then if you have other medical history, like for example, history of keloid forming or hypertrophic scar, you should also tell your dermatologist about it. And then if you're taking any oral steroids, especially if you're taking high-dose oral steroids, you should also tell your doctor so that it could be tapered or discontinued prior to having the procedure done. And then there. So CO2 laser is really a good laser. It's also treated not just for the acne scars. It's great for seborrheic keratosis, sunspots, for warts, for skin tags. It's also used for rejuvenation, to improve the signs of wrinkles. And I do suggest you seek a consultation with a board-certified dermatologist within your area, or if you're in La Union, come visit me here at Skinmatters. We're just along San Fernando City, along Quezon Avenue, sa main road, near the market, across Mercury Jug. So, I do hope to see you not only visiting my videos or watching my videos, but also face-to-face when you come visit me in my clinic. Thank you so much for watching my video. I do appreciate it when you tell me na, "Hi, Doktora, I saw your video. I watched all your videos." I do, nakakataba ng puso sa lahat ng mga nagsasabi nun sa akin na, "Ay, Doktora, I follow you on Instagram, ah." So, just hit the like button, subscribe to my channel, comment below because ako mismo, I'm the one answering your question. I take time to think ano kaya sasabihin ko dun sa question na yon and how I can help you because I feel so blessed na I am able to treat patients, their skin, hair, and nail concerns. See you in my next video. Bye!